Okay, hello. My name is Kyle Sanchez, and I'll be your day shift nurse. Go ahead and give me your reports. My name is Kyle Sanchez, ICU nurse at MacMed at the second floor. And so here's my stethoscope, badge, goggles, everything. I mean, no, not goggles. Pen light, gloves, flushes. And so yeah, let's go ahead and take a look at the patient and go ahead and give you a brief breakdown of how I went throughout the shift. And so, looking at the identification badge, oh, how are you doing? Then you're going to be your night shift nurse, and so let's just go ahead and get to it. And so to verify her name and date of birth is LF, 75-year-old patient, female. She brought to the ICU, room 202. And so from here, let's go ahead and give you a quick breakdown. She was admitted with hypertensive crisis, and the patient was brought to the ER, hypertensive crisis in the 200s, systolic, and so she also had a blood glucose of 400s. And so from here, she was giving clonidine, 0.2 milligrams, and she ended up bottoming out and ended up having a systolic blood pressure of 80s, and her blood glucose was 400s. They went ahead and pushed fluids, tried to stabilize her. She was still low, and for her glucose, they gave her 10 units of sub-Q insulin, and so that brought her down to about 191. And so from here, she was brought to the ICU when it evaluated her, checked her out. And so her patient history, past 4 days, she had weakness, she had dizziness, and she had a fever. She even had a fall that brought her in. So she came in, had those symptoms, precipitating symptoms, and then obviously she bottomed out, brought to us. And so from here, we were just trying to assess her history. Her daughter was here and her husband was here. And so she has history of asthma, hyperlipidemia, diabetes, hypertension, heart cath, and sleep apnea, just to name a few off the top of my head. And so just looking at, like, I'm just off the top of my head, so I'm not, so just look at the lab values, boom, 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 on the computer. And so from here, after we gave her fluids, we're gonna go ahead and evaluated her. So when we're evaluating her, her blood pressure jumped again to about 150 over 78. No, 178 over like 184. So it got high. She was tachycardic about 110, 115. She also has a history of anxiety. She got really panicky. We went ahead and gave her a two liters nasal cannula so that helped her out. She was still tachycardic. We went ahead and put the bed in an incline. We're going to take her blood pressure, continuous blood pressure and heart rate. And so from here, we're just evaluating her neurologically head to toe. Neurologically, she was AOA times 4. She did have a quivering lip. We asked the family members, said that she has had it for a while. She actually has Parkinson's, but she's on no medication. And so lab as we're looking at where her bun level was about 44, hematocrit was about creatinine was about 1.7, so creatinine is 1.7. We're looking at about kidney injury or damage. We're looking at her bun levels high, maybe dehydration or some sort of damage as well. When we're looking at her white blood cells, about 111, about 1100. When we're looking at her red blood cell, which is basically the amount of red blood cells she has in the body, transport oxygen, hemoglobin that actually carries oxygen, and the hematocrit, which is the test for anemia, they were all low, about 3.64, 8.76, and 29. And so these just show that she probably suffers anemia. We asked the family. They did say that her last visit with her home provider, he did say that she probably does have anemia and needs to be treated. And so other lab values, yeah, white blood cell, kidney. Oh yeah, she did have a D dimer that was about 1.7, I believe, so positive for clots. She did take a CT scan of the head. She had nothing abnormal, no lesions, so everything came out negative. And so from here, still assessing the body. Yeah, head up, everything besides that normal. Perla, we checked out her pupils, round, equilateral light, 2 milliliters each. Checked her throat, no signs of swelling. Looked at her abdomen area. So her heart, we did check her heart sounds. She did have normal S1, S2, no murmurs, but she did have an increased cardiac rhythm, and her apical pulse for a minute was about 104, 105. We checked her respiratory sounds. She did have diminished sounds some of the bottom of her lungs, and she did have, it seemed like pulmonary edema. It was rare. You could tell like she had like inflammation when she was breathing in, and she also had that that extra wheeze at the end. So she was wheezing. Cardiac, went over that. Renal, went over that. Also, when we got to her lower extremities, She did have edema +2 on both bilateral extremities. When we checked her grip and her muscle strength, she would have moved both arms up and down. She would have gripped my hands with a strong strength. She would have pushed down with both of her feet, lift them both up simultaneously. And so, just looking at her skin, she did have she went ahead prepare look like she bruised herself when she fell on her right antecubital on the bottom of her forearm, and vital signs respiratory was 34. At the end, we ended up giving her Presidex, which is basically just a sedative. It's used to calm a patient down. We did it by an IV infusion, and it was about 200 micrograms per 50 milliliters. I honestly forgot the rate. Doxycycline was about 100 milligrams per vial. When I gave her that over 1 to 4 hours, it was a broad spectrum the provider ordered. So just because she had a high white blood cell, we gave her doxycycline. Because she was anxious, nervous, wanted to calm her down, we gave her Presidex. And so blood pressure, about like we said earlier, respiratory rate, heart rate was elevated, and temperature about 136.7. We talked about the edema. Her strength was good. So basically, we're really monitoring her just so that she's making sure we have accurate breathing, right? She came in with that 2 liters nasal cannula. She ended up having like an anxiety attack. We ended up giving her non-rebreather mask, and at about 15 liters per minute. Really helped her. She's been stabilized in the 92 SpO2, which is good. She feels stabilized. Her husband was there. He was calming her down. He was praying for her. And so went over medication. She has a standing order of Tylenol if she needs it. And we're still waiting a chest x-ray, a CT of the chest. And we're still waiting that. She did a PCR test, came back negative for flu and COVID. And we already went over current medications. She does have 2 IVs, left and right antecubital, and she has no drains. She did pee out urine. We could put in a urinal. She got 150 milliliters in the last last 2 hours, and we're just also waiting a VQ scan, which is a ventilation perfusion scan. Basically, it just detects the perfusion in the chest area. It's usually the dye, so we can actually spot out if there's actually areas where there's no perfusion or ventilation. So the breathe in, breathe out, your body's getting oxygen, carbon dioxide release, as it's identify clots or areas where there's not. And so I would recommend that we get probably a UA. I want to really check that. I want to check her urine. I want to check what's coming out. And I'd also say, honestly, her lungs sound like she's pretty congested. I don't know if it's from the fluid she got earlier. I don't know if she already had maybe a history of heart failure or something like that, but she did sound like she was really congested in her lung area when we were assessing. So maybe even ask the provider, maybe get a BMP. She was anemic on the red blood cell wise, so get her probably maybe a pack of red blood cells. Also probably Lasix, maybe to kind of flush her out, see how she does after evaluating her electrolytes. And apparently she does use a CPAP or BiPAP, so we want to kind of ask the family if they could bring that mask there, or ask the provider we could get one for her. And so just kind of going over just, I guess, risks. I mean, fall risk is a huge one for her. I would tell you, make sure we're in the lowest setting, make sure we're having her up, make sure we're having at least 3 side rails up, and having to call it and reach. Infection control, we're still waiting to see if maybe we could get another kind of test done. See if there's maybe even some specific assay to check if it's cones and rods, see if there's a specific type of bacterium. So just make sure you're using standard, right? So make sure you come in with your gloves, maybe mask, and then make sure you have proper hand hygiene. Code status, she's full code. Mobility, she can move, but we're gonna have her on bed rest. We have her urinal there. Just because she already fell once, we don't want to fall again. Pressure injuries, we'll go ahead and move her every. We'll go ahead and do a neural assessment probably every 1 to 2 hours, and we'll go ahead and move her every probably 2 hours. We want to make sure we're avoiding pressure injuries. Also, just discharge plans, probably discharge her. To talk to the provider about it, maybe get her some ADL. Also, do some education on fall precautions, lowest setting. Make sure she has an assist if she feels dizzy. Maybe get her a cane or some sort of assistive device if need to be. Make sure she knows the medications, their purpose, what they do, and to stay on them. Just because it feels like she does, even her Parkinson's, she didn't have medication for that. Making sure her blood pressure medication, make sure she's taking it. Make sure cholesterol medication she's getting checked, so she's getting that checked out. And so discharge wise, we're still waiting the x-rays and the CT and probably just the BQ. So maybe not till Monday, but we will be updating her family. And so yeah, from that, we're just evaluating that, keeping her up to date, making sure that we could really monitor her kidneys and her pulmonary status and her blood pressure. and so her circulatory system, respiratory system. And so we're just gonna go from there. If you have any questions, you have my number, and I'll be here in the next morning shift. So thank you so much.